As countries mark World Cancer Day, Discovery Health has expressed shock at the drop of cancer screening as a result of COVID-19. It estimates a 24% drop in breast cancer screening and a 25% drop in cervical cancer screening in 2020. It also recorded an 18% overall decrease in oncology registrations between June 2019 and June 2020. This means that fewer people were diagnosed with cancer. Let's get more on this. We're joined by Dr. Noluthando Nematswareni from Discovery Health. Thanks very much for joining us, and a warm welcome to you.
Thank you so much. Good afternoon, and good afternoon to the viewers.
Doctor, let's talk about this drop in screening, and of course we're hearing that it's because of COVID-19 having an effect, but what exactly is the reason? I mean, is it the fact that people are more concerned about COVID-19 and kind of ignoring other medical issues? What are you finding to be the reasons that people are not screening for cancer? And I would imagine that it's other diseases too that people are maybe neglecting to test for because of the grave concern of COVID-19.
No, thank you so much. I think that's an important question, and I think the reasons are multifactorial. So if you think about it, firstly, COVID-19 services were prioritized during the pandemic. So it meant that some of these services were not maybe accessible to a lot of people. The other thing was that people were fearful of going to healthcare facilities because they thought, if you go there are other people who are sick, you could expose yourself to COVID-19. Yeah. The other important aspect around screening, obviously, is just if we think about pre-COVID, our screening rates were already very low. So the pandemic really worsened a situation that was already not optimal. So I think it's all those factors really. And I think from a diagnostic point of view, because some of the elective surgical procedures were also, deprioritized. So which talks to the 18% reduction in diagnosis of cancer. So it's not only the screening component that contributed to that. There's also the aspect of ensuring that people are getting into facilities and getting diagnosed as well.
This is a question I think I've asked several health experts and people who work in the medical side of the world. That it seems to me that it would be easier to kind of do everything in one place. So if for example a person's coming in for a test for COVID-19, why then not check full health altogether? Just kind of do a whole test and to see if everything is okay. Since you are there anyway, you might as well then check anything. Is there anything that Discovery Health is perhaps doing in terms of encouraging that, where you kind of say, well, since you're going for that for that test for COVID, why don't you also just test other things, since everything is there anyway? And I mean, you're talking about the issue of accessibility. Well, there's the access right there. So why can't we just do everything all at once? I wonder if there's no possibility to do that.
I think it's a very good point that you're making, because I think access and also, the full suite of screenings, if they are accessible in one sitting, it then makes it more, it makes it more convenient for the person who's coming to seek that particular healthcare service. So unfortunately, you will understand that has not been the structure of the healthcare system pre-COVID, but it really does, allow us to think more creatively around how we then structure these screening services. So if you think about mammography, for example, those services are very specific. They are specialized centers that are run by radiology practices, and therefore, you won't necessarily get it when you go into a normal screening in a pharmacy. Yeah. Whereas for most chronic conditions, if you go to a pharmacy setting where some of these screening tests are being done, and also in the work environment where wellness events are run, there is a multitude of tests that are offered on those days, where you test for diabetes, you test for hypertension, you look for your body mass index to screen for obesity and overweight, and also you screen for other mental health related issues. So already there are some components of putting together a multitude of tests to make sure that there's convenience. But I think you are right that there are some that still sit outside of this comprehensive offering. And I think it's an important aspect going forward in terms of thinking about, for example, pap smears.
Yes.
How do you bring them closer to the consumer or to the person who needs to be screened? Because usually you'd have to go to your healthcare practitioner for a pap smear to be done. So I think it's an important point that needs to be taken forward going, when we think about the post-COVID era.
Doctor, will COVID-19 impact, after just listening to what we're talking about now, will COVID-19 have, an impact on cancer screening in terms of meaning that maybe people are diagnosed with more advanced cancers, or, they catch it later on? And what can you tell us about the consequences of prolonging cancer screening? Because from what I understand, with cancer, it's the easier it's caught, the better. And I wonder if this is, becoming quite problematic when we're talking about mortality, when we're talking about, death rate at the end of the day.
No, definitely. The reason why we are raising awareness around this particular issue is because we are concerned, because we know that early diagnosis of cancer really improves survival. So if we think about, for example, breast cancer, for those people who find their lumps still very localized, they can still be removed, they can still be treated. The survival rate for those people is closer to 100% in a 5-year survival rate type of scenario. But we do know that it significantly drops when it is caught later, when it has already spread to other parts of the body. And also it's much more complex to treat and, much more expensive to treat when you catch it much later. And I think the most important thing is that the survival benefit is therefore also reduced. So we really encourage people, because the benefits are available. Specifically when I'm looking at privately insured people who, across all the various medical schemes, these benefits are there. And what we have been seeing is that people are really not accessing these. And I think the awareness component is important, but I think access and making sure that people find it much easier to access these services is the next initiative that we should be driving over and above the awareness that we create.
Yeah, and while we're talking about awareness, Doctor, and maybe this is the perfect place to close off our conversation, while you're encouraging people to go indeed to get tested and go for screening. I mean, breast cancer and cervical cancer are common cancers in women worldwide. Routine screening tests are scheduled at specific time intervals depending on one's cancer risk profile. Talk to us more about how often then one should go for screening, and what screening method is used for these common cancers in women.
Thank you so much. So for breast, we've been talking about mammography, which is obviously an X-ray of your breast. The risks, the screening program and the recommendations obviously take into account a person's risk. So if you've got a high, if you've got a very strong family history of breast cancer, where your mom might have had it, your grandmother might have had it, your maternal grandmother. So we look at those individuals differently, and there are additional tests that need to be done to actually assess if you really need additional screening methods. But for those people with a very strong family history and a high risk of getting breast cancer, they usually would then screen with mammography every year. If you are an average risk person, so we're saying there's no real family history, there's no risk that we can identify, those people can then do the screening every 2 years. Yeah. With cervical cancer, so there's also obviously that you check the risk of the member or the patient, and then if there is no real risk that is identified, then we say at least from the age of 25 you should be going every 3 years for pap smear screening. Or if we're using the other test, which is called the human papillomavirus test, you can go every 5 years. Similarly, if you are high risk, that is people living with HIV, if you are going for your cervical cancer screening, it's pap smears every year, or a human papillomavirus screening every 3 years. So it is really understanding your risk, and therefore the frequency of screening that is required or recommended based on your risk profile.
All right, Doctor, thanks very much for speaking to us. We appreciate you giving us your time here on SABC News.
Thank you.
All right.